Every 40 seconds, someone in the U.S. has a stroke, and in half of those cases, 3 silent habits are to blame. You don't feel them, you don't notice them, but they're quietly damaging the blood vessels in your brain day after day until something breaks. I'm Dr. Jonathan Myers, and after 30 years treating stroke survivors, I've seen the same 3 behaviors come up again and again, habits people thought were harmless until they weren't. In this video, I'll show you what they are, how to spot them, and most importantly, how to stop them before it's too late. These aren't just tips, they're brain-saving changes. Let's get started. Most strokes don't come out of nowhere. They build over time, fueled by habits we repeat every single day. Sitting too long, eating too much salt, or ignoring sleep problems might not hurt today, but they quietly raise your blood pressure, stiffen your arteries, and disrupt blood flow to your brain. The danger is silent. You won't feel inflammation building in your vessels. You won't notice small clots forming. But when one finally blocks an artery in your brain, the damage is immediate and often permanent. That's why identifying harmful daily patterns is just as important as knowing stroke symptoms. Prevention doesn't start in the emergency room. It starts in your routine. Let's look at the first habit. Habit 1. Sitting too long without breaks. You might not think of sitting as dangerous. After all, it's how we work, relax, eat, and unwind. But sitting too long without taking breaks is one of the most underrated stroke risks, especially after age 60. Here's what's happening inside your body. When you sit for long hours, your blood flow slows dramatically. Your leg muscles, which normally help pump blood back to your heart and brain, go inactive. This leads to blood pooling in the lower limbs, increasing your risk of clot formation. And those clots, they don't always stay put. Some can break loose and travel to the lungs or even worse, to the brain. Beyond clot risk, sitting for extended periods raises your blood pressure, increases insulin resistance, and triggers systemic inflammation. All of these silently contribute to artery damage and plaque buildup, setting the stage for a stroke without you even realizing it. You might think, but I exercise every day. That's great, but it doesn't cancel out 12 hours of sitting. Studies show that people who sit for more than 8 hours daily, even if they hit the gym, still face a significantly higher stroke risk compared to those who move regularly throughout the day. So what's the solution? Simple: break up your sitting time. Set a timer for every 30 to 60 minutes. When it goes off, stand up, stretch, walk to the kitchen, march in place for 60 seconds, swing your arms, shake out your legs. These tiny movements help reactivate circulation and reduce clot risk. You can also build movement into your habits. Do heel raises while brushing your teeth. Take phone calls standing up. Keep your remote or charger across the room. Do 5 air squats before meals. If you work at a desk, consider a standing desk or take walking breaks during calls. Watching TV move during commercials or every episode. Think of it this way: movement is medicine. These micro-activities may feel small, but they send a powerful message to your brain, and arteries stay active, stay alive. And if you've already had a stroke or mini-stroke, this habit isn't optional. It's essential. Regular movement protects your recovery and helps prevent recurrence. Sitting isn't evil, but sitting too long without breaks is dangerous, it's quiet, it's common, and it's absolutely changeable starting today. Now let's talk about Habit 2.1 that's sitting in your pantry right now. Habit 2. Too much salt from processed foods. You probably don't grab the salt shaker and pour it over your breakfast, but if you're eating like most Americans, you're likely consuming far more sodium than your brain and heart can handle, and most of it comes from processed foods, not your kitchen table. Here's the truth: over 70% of the salt in our diets doesn't come from what we add during cooking. It comes from packaged, canned, frozen, and fast foods, the things that seem easy, quick, and convenient. Why does this matter? Because too much salt raises your blood pressure, and high blood pressure is the single most powerful risk factor for stroke. When you eat too much sodium, your body holds on to water to dilute it. This extra fluid increases the pressure inside your blood vessels. Over time, that constant high pressure damages the delicate walls of your arteries, especially the tiny vessels in your brain. This damage makes them more prone to blockage or rupture, which is exactly how a stroke begins. And the damage is cumulative. You won't feel your arteries stiffening or see the plaques forming. You won't notice the increased resistance in your blood vessels. But your brain will sooner or later. Let me make it more practical. These are common high-sodium foods many people eat daily without thinking. Canned soups, deli meats and sausages, cheese slices and processed cheese spreads, frozen dinners, fast food sandwiches and fries, store-bought salad dressings and sauces, instant noodles and flavored rice packets, bagged chips, crackers, and pretzels. Even healthy options like turkey breast, whole wheat bread, or veggie burgers can pack in hundreds of milligrams of sodium per serving. Here's the target: if you're over 50 or have any cardiovascular risk, you should aim for no more than 500 milligrams of sodium per day. That's about 2/3 of a teaspoon of salt total, and trust me, it adds up quickly. So what's the solution? First, read labels. Pay attention to the sodium content per serving, not per package. A low-sodium label legally means 140 milligrams or less per serving, so aim for products with that designation when possible. Second, cook more meals at home using fresh, whole ingredients. When you control the salt, you control the damage. Use herbs, lemon juice, garlic, onion, and vinegar to build flavor instead of relying on salt. Third, don't trust natural or organic labels to mean low salt. Organic canned soup can have just as much sodium as regular brands. If you must buy processed foods, choose low-sodium or no-salt added versions. For example, swap salted peanut butter for no salt. Peanut butter. Choose fresh or frozen vegetables instead of canned. Select unsalted nuts and snacks. Use plain yogurt instead of flavored. And when dining out, ask for sauces on the side or request that your food be cooked with no added salt. Restaurants are notorious for over-salting. Remember, stroke prevention isn't just about avoiding the salt shaker, it's about avoiding hidden sodium, where it lives in convenience foods, frozen meals, and restaurant dishes. And if you're already on medication for high blood pressure. Cutting back on sodium makes those medications more effective and may even reduce your need for them over time. Let me be clear, salt isn't evil. Your body needs sodium to function. But too much every day for years, that's a slow path toward artery damage and stroke. You don't have to eliminate salt entirely. Just be aware, make swaps, and choose fresh whenever possible. Your arteries will thank you, and your brain might just stay healthier for decades. Now let's move to the third and final habit, one that could be harming your brain every night while you sleep. Habit 3. Ignoring snoring or sleep apnea. If you or your partner snores loudly every night, it's time to stop brushing it off as just snoring. Because what sounds harmless might actually be a warning sign of sleep apnea, a silent condition that dramatically increases your risk of stroke. Sleep apnea is a disorder where your breathing repeatedly stops and starts while you sleep. These pauses can last seconds to even minutes. When your brain doesn't get enough oxygen during the night, your blood pressure rises sharply to compensate. This cycle, low oxygen, then pressure spikes, happens over and over, sometimes hundreds of times per night. The result: long-term damage to the blood vessels in your brain and neck. Studies have found that people with untreated sleep apnea have 2 to 4 times higher risk of stroke, and they often don't know they even have it. You might be thinking, I sleep fine, or I don't wake up gasping. But many people with sleep apnea aren't aware of the nighttime episodes. Here are key warning signs to watch for. Loud chronic snoring, pauses in breathing observed by a bed partner, morning headaches, waking up tired even after a full night's sleep, trouble concentrating during the day, mood swings or irritability, waking up frequently to urinate at night. If these sound familiar, don't ignore them. Left untreated, sleep apnea not only increases stroke risk, but also raises the chances of high blood pressure, heart attack, and even sudden death during sleep. So what can you do? The first step is talking to your doctor. They may recommend a sleep study, which can be done at a sleep clinic or even at home with a simple monitoring device. It tracks your oxygen levels, breathing patterns, heart rate, and body movements throughout the night. If you're diagnosed with obstructive sleep apnea, treatment can make a life-changing difference. The most common and effective therapy is CPAP, a machine that delivers continuous air pressure to keep your airway open during sleep. It may take time to adjust, but patients often report feeling dramatically better within days or weeks of consistent use. Other options include Weight loss if overweight a major contributing factor. Changing sleep position, sleeping on your side, may reduce symptoms. Avoiding alcohol and sedatives before bed. Mouth guards or dental devices to keep the airway open. Surgical options in severe cases. Treating sleep apnea doesn't just help you sleep better, it protects your brain. When your brain is deprived of oxygen night after night, it accelerates cognitive decline, damages blood vessels, and makes your system more vulnerable to clots. And if you've already had a stroke or mini-stroke, diagnosing and managing sleep apnea is one of the most critical things you can do to prevent recurrence. Here's the bigger point. Snoring isn't just annoying. It can be a neurological red flag. If your partner snores like a freight train or stops breathing while asleep, encourage them to seek help. You might just save their life. Many strokes happen overnight when sleep apnea is at its worst. The person doesn't wake up. They're found unresponsive in the morning. I've seen it too many times in my career, and it's heartbreaking because it's preventable. So please don't ignore the signs. Get screened, get treated, and protect your brain every night, not just during the day. Now let's wrap things up with a final word of advice, plus a reminder that changing these 3 habits might just save your life. Every stroke I've treated started long before the ambulance arrived. It began with daily choices like sitting too long, eating too much salt, or ignoring snoring that signaled something deeper. But the power of prevention is real, and it's in your hands right now. These 3 habits may seem small, but stopping them could literally cut your stroke risk in half. That's not a guess, it's backed by decades of medical research and patient outcomes I've seen firsthand. So here's my advice. Start with 1 habit today. Set a timer to stand up every hour. Read a food label before your next meal. Talk to your doctor about your sleep. And if this video helped you, please like, subscribe, and share it with someone you care about. You could be the reason they prevent a stroke. Your brain is worth protecting every hour, every bite, every breath.